Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome. We are talking about our upcoming Gold Lactation Online Conference, and I am here today with Annette Leary, who is going to be participating in Gold Lactation Online Conference 2021. We should say the date, Annette, is just so fantastic. We're moving forward. How are you doing today?
I'm doing great. I can't wait. I've been planning this since, oh my goodness, I think it's been since last September, October. So it's going to be fun to finally share it with everyone. I can't
Yeah.
wait.
Yeah, no, honestly. And there is a lot of planning that goes into these things on part of our team here at Gold, but of course, on behalf of our presenters. And I know when you and I first started talking about it, how giddy we were about it, because we've been talking for years. Literally, I think
Absolutely.
about you coming to talk at Gold.
Yeah.
And we were just talking offline that the last time we saw each other in person, I think it was at a conference. But of course, we were sitting by the pool. Um, which was a little bit different, but
Yeah.
we'll keep dreaming and it will happen again, right? Put it out there.
2022. We got to
We're
have
going to
it.
be there. We're all good. We're going to see all of you as well, which is going to
We're
be
going to,
great. It'll be
absolutely.
Annette and Fiona hosting for sure.
Yeah. Very good.
Well, I guess we should talk a little bit about what's coming up. But before we do that, I feel like I'm going to keep you all to myself, but really, I want to share you with the world here at Gold. And so please introduce yourself and, tell us a little bit about yourself personally and perhaps a little bit about your professional world as well, Annette.
I'd love to share that. Thank you. And again, I can't thank Gold enough. It's been just a wonderful experience working with you all. So thank you. Thank you. Really made this a fun experience. But yes, I've been a nurse for over 32 years now. Oh my goodness. When I'm doing staff training and I say that and the young nurses look at me and they make me feel like I'm like that old nurse. I remember when I first graduated. But yeah, been a nurse for over 32 years. My background started in pediatrics. And, those of you that are nurses out there, that old time you would get sent to a med surg floor. And I was never a med surg nurse. I was always a mother baby nurse. So I got blessed and got to get some experience in mother baby and level 2 nursery. So that was my introduction into working with many families all over. I was started in the Boston area and now I'm in Orlando, Florida, beautiful sunny Orlando, Florida. So it's about 7 p.m. Oh, you see Daisy just hopped up
Oh,
there.
there's Daisy.
This is our fur baby because we had to do that during COVID because our children are all over the world. I have 4 children. One does live locally and gives me the beautiful grandchildren, which you'll get to see a slide in my presentation. I have an opening slide as part of my credentials, my children. I have 2 boys out in LA and I have my daughter in New York City, the hardest hit areas in the United States for
Yes.
COVID. So it was a little bit crazy, but this Miss Daisy here has kept us having fun and giggles and calmed us all during this time. So yeah, and I have a private practice. Orlando Lactation and Childbirth Services. I've been doing that since I moved back to Orlando in 2002. I have been training the last 7 years in upledger trained in craniosacral therapy techniques. And I've been very blessed now. It's like this beautiful blend of lactation with body work and, working with the parent, getting the parent on the table, moms, dads, partners, everyone gets on the table with the baby and doing the body work on them and just seeing the beautiful results of the baby starting to feed better and the connection with the whole family, feeling a lot better about what's going on. So yeah, so I lead a pretty busy life. I work at the hospital on Monday through Thursday. I see patients after work and I see them all day Friday. And on occasion, many of you know that crying mom that will call you and say, can you please fit us in anywhere? So, I may open a Saturday up for a few clients, but I'm very blessed. I'm very blessed that I get the trust and the invited into their worlds. That's the big part for me. Whenever they say thank you, I say no, thank you. Thank you for trusting me to help you and assist you and trusting my knowledge and guide you where you need it when you want it to go. So yeah. I
Oh,
lead a very full professional life when it comes to those kind of things, and getting to do having the opportunity to speak for Gold, and
yeah.
I'm also going to present for Upledger Institute on tongue ties and body work and babies. So it's been busy. It's been a new world though, learning to present virtually. I mean, I did one a couple of years ago, and
Mm-hmm.
I love the live interaction with the audience. So this was right up my alley when you said we could have it be interactive, and we have lots of polls in
Yes.
my presentation, and we have some homework. So hopefully those have signed up have had a chance to view the homework. It's not bad homework. It's just kind of being prepared to give feedback and respond
Mm-hmm.
to the quick polls, and it'll be helpful.
Yeah, absolutely. Yeah. Well, thank you for sharing. I know how full and how busy you are. I have to say that we're blessed to have you here, have some time
Thank
for
you.
us. So,
Thank you.
but it's wonderful to have your clinical experience here. And
Thank you. I'm looking
yes.
forward to sharing, and all of the case reviews that we have are actual scenarios
Oh, that's
that
great.
we have had, and it was so hard to just narrow them down
Mm-hmm.
to just a few.
Mm-hmm.
What we did, but yeah, they bring some shock value when someone said, "Did a parent really say that to you?" I'm like, they did,
Well, that's
and
good,
this
and I
is
think those that's going to be really important to share. So let's share a little bit about this actual topic, and tell folks what exactly you're going to be doing. So Annette is going to be part of our interactive sessions, which we have 4 of this year. So check them all out. You can find them on the delegates dashboard as part of our conference. And Annette's actually going to be speaking about interactive case review, prioritization of care. So this is going to be really important for, I mean, I think for any of us, because sometimes, even if you're, for some of us who are not busy, but, sometimes it'll happen. We'll get calls come in at the same time, or, someone that needs to be prioritized over another. And that does make it challenging. So I'm really
yes.
keen to hear, I know you're going to be doing part of that as the process here, but as you mentioned, and I've been calling it homework,
Hmm.
but it really just helps you take it. I say it helps you take advantage of the presentations that we have here, the interactive sessions that we have, to do some of the prior work, to really
Yeah.
situate yourself well. Not required by any means. Like, we
Yes.
made it as open as possible, right, Annette, for everybody?
Yes. Exactly. We did. So it'll be great. I like to say, I also threw in there, I like to start with some critical thinking skills. We all
Mm,
have those,
mm-hmm.
and just how to hone in on them and how they can help you with whether it's prioritizing cases, who to see first. Not that one person is more important than the other, but
Right.
sometimes you do get, whether it's an emotional need, whether it's a physical need. We need to look at that when figuring out, all right, I've got 4 calls to return. I used to think, oh, let me return them in the order they came. Isn't that just fair? Well, it all
Yes.
depends on what the information that the parent left you on
Mm,
on the telephone.
mm-hmm.
Or I hear it a lot from the staff at the
Mm-hmm.
hospital where I work, and we train staff, and even our team members will say, oh gosh, I have these 4 cases. Who should I see first? And we approach it in a different angle. Like, if they're getting ready to go home, let's get in there and see them, even though this 16-hour-old baby hasn't latched yet. Get them
Right.
skin to skin, and let's get in there and see the mom walking out the door who's still
Yeah.
finger feeding. So it's looking at that approach
Fabulous.
from different environments that we may all work in.
Yeah, no, that sounds fantastic. I even get a sense of confidence building,
Yes.
in terms of what I'm seeking as well, and I'm always looking for those little tools and tricks on how to do
Yes.
that. And I mean, we anticipate that all of you are going to come as well and share your experiences with myself and Annette and everyone online. Like, this is about collaborating, working together, so we're all going to be doing some of that learning together, which is, I think, one of the reasons that you first said, "Oh yeah, this is going to be awesome." We're going to be able to work together.
We're going to put together a resource list that we can
That's right.
share globally, and maybe some intervention. I call them interventions, but I don't know if they're really interventions or just techniques that you
Mm-hmm.
use when
Yep.
working with a family, and helping them decide, or helping them, kind of get a place of calm or feel more confident themselves.
Hmm.
Today I was we train. This is one of the big things we do because we have our hospital has over 14,000 deliveries a year,
Wow.
which is a lot. We have a
Yeah.
150 bed we have a 150 bed neonatal intensive care unit.
Oh, wow.
So when we were training staff, the one thing I start the day with, I say, when I walk out of my car each morning, I ground my feet and I say, wow, how lucky am I to
Mm,
introduce this parent to her superpower, his or her,
mm,
their superpower,
right. Oh,
right?
wow.
And what is that superpower? The ability to grow a beautiful baby and keep them alive with their milk
Mm,
from their chest, right?
beautiful.
And
Yeah.
it's a beautiful experience that I get to empower that mom, encourage that mom, engage that family, that parent
Hmm.
with their child.
Oh, wow.
So with their new baby.
Yeah.
So
Yeah.
that's one of the things we talk about is empowering them and teaching them how to utilize their superpower.
Mm,
Yeah.
wow.
So and
Oh,
then and
goosebumps.
the staff look at it so differently once they say that. They're like, I didn't realize my job was so
Right.
important. And these are the bedside nurses because all of our bedside nurses have to go through this training. It's not,
Oh,
yeah, this is all bedside staff that
mm.
they're trained in 18 hours of lactation during their orientation,
Oh,
which is
good.
great. And it's
Yeah,
it's a
really good.
4 hour didactic, and then they go and they apply everything they learn in the afternoon doing bedside care with our dedicated lactation team.
Mm, that's
Yeah.
fabulous. Wow. Oh,
Yeah.
like I said, goosebumps. I tell you, this is a moment to definitely work towards. And so do join us. Thank you so much, Annette. This has been great just chatting about this just briefly, but there is so much more to come. So be sure to come and join us live. Take advantage, as I mentioned, of all
Mhm.
the tools that have been provided to you prior to the session. And there's going to be lots online. Now, of course, if you can't come live, we understand. We know that you're very busy right now, but take advantage of everything. The forums will be open as well. You'll be able to come and do the pre-homework and message Annette on the forums. She'd be happy to answer any of your
Absolutely.
questions. And, after you've listened to the recording, it's going to be absolutely fantastic. Well, thank you again to Annette Leary for sitting down with me here today. It's been great catching up with you, Annette.
Terrific. Thank you. And stay well, everyone. And I'll see you guys next Monday, the 26th.
Yeah, that's fantastic. Yeah, so you can go to the website right now at goldlactation.com. If you haven't registered for this event, it is still open and ready. Lots of time for you to listen to many more live events and, of course, all the recordings as well. We'll look forward to seeing you online, everyone. Bye bye for now.